So today's question is, a 54-year-old woman presented with recurrent episodes of diaphoresis, palpitations and blurring vision. The patient had another episode in the office. BP was 148/90, pulse rate was 110 and respiratory rate was 20 per minute. So blood investigations revealed a serum blood glucose of 50 mg per deciliter and the symptoms was relieved after administration of glucose. And investigation revealed high levels of C-peptide and high insulin levels. What's your diagnosis? So let us come to the summary of this case. So the patient is having sweating, palpitations, blurring vision and blood glucose is very low. So the patient is having hypoglycemia and all these symptoms are attributed to hypoglycemia and it is reversed after administration of glucose. So all these are basically due to hypoglycemia. Now we have to find out why the patient had developed hypoglycemia. So they have given the patient is having high insulin levels and high C-peptide. So what does the C-peptide indicate? So you would have learned in your biochemistry, whenever insulin is being released, a part of amino acid sequence is cleaved, so your C-peptide will also be released along with it. So it indicates that there is an endogenous production of insulin. When you are going to have exogenous insulin, you won't have C-peptide levels. Okay, so basically the patient is having high levels of insulin, which could be due to an exogenous administration or an endogenous cause. Okay, so now let's go for the options. So now look at the options. So you're having insulinoma as an option. So your answer must be insulinoma. So what is insulinoma basically? So insulinoma is nothing but a pancreatic neuroendocrine tumor. So your pancreas has got exocrine function and endocrine function. Exocrine function basically helps in digestion, whereas in your endocrine function you have a lot of other functions. So your pancreas have got a lot of cells, your alpha cells, beta cells, delta cells. They have other types of cells like D1 cells. So your beta cells will secrete insulin, alpha cells will secrete glucagon, your delta cells will secrete somatostatin, your D1 cells will secrete vasoactive intestinal peptide. So when you have tumor of this alpha cells, we call it as glucagonoma. When you have tumor of these beta cells, we call it as insulinoma, and likewise somatostatinoma and VIPoma. So all these are very important. Okay, why? Because if you're going to treat it, there can be a drastic improvement. Sometimes the patient can die of hypoglycemia, right? So you have to realize the cause and treat the underlying cause. And another important reason to identify this neuroendocrine tumor is they can be associated as a part of MEN1 syndrome. So what is MEN1 syndrome? You remember 3 P's: pituitary, pancreatic neuroendocrine tumors and parathyroid hyperplasia. Okay, so 3 P's. In your pituitary, you can have pituitary tumors like your pituitary adenomas. Most commonly, you have prolactinoma. So remember, MEN1 has 3 P's: pituitary, pancreatic neuroendocrine tumors and parathyroid hyperplasia. So what is specific about insulinoma? So when you have seen the yesterday's discussion, I was telling in medullary carcinoma of thyroid, you see amyloid-like deposits. Like that, insulinoma is one pancreatic neuroendocrine tumor where you can see amyloid-like deposits. So you can have similarly a gastrin producing tumor either in the peripancreatic soft tissue or due to gastrin producing tumors in the stomach. So this occurs in gastrinoma triangle and this is the gastrinoma triangle. This is also a pancreatic neuroendocrine tumor. So the gastrinoma triangle is otherwise called Saro's triangle, which is formed by junction of head and neck of pancreas, second and third part of duodenum and cystic duct and CBD. So what is this? You have a erythematous rash which is migrating. This is called necrolytic migrating erythema. So this is one characteristic feature seen in glucagonoma. Okay, so everything has some characteristic feature. Likewise, you can have a tumor which secretes a lot of vasoactive intestinal peptide. This we call it as VIPoma. And here you have to know about one thing called WDHA syndrome, which includes watery diarrhea, hypokalaemia and achlorhydria. And similar symptoms can be seen even in neuroblastoma and ganglioneuromas. Okay, so that's about the pancreatic neuroendocrine tumors. Thank you.